Hi, I'm Brittany Montez, and this is the Orlando Health News Review for June 6th. For our first segment, we're going to go over to the Orlando Health News Review studio. Today we wanted to learn a little bit more about the Orlando Health CFO role. So this is Rock Your Role. We have 3 CFOs here and 3 statements that they're going to answer either true or false. So please welcome to the studio Kurt, Latasha, and Daniel. You guys ready to get started?
We're ready.
Okay, here's the first statement. $1.5 billion is budgeted this year to meet the payroll of our team members. True or false?
True.
You guys got it. Latasha, can you explain a little bit more about that for us?
Sure. Generally, most companies will spend, for every dollar that they make, they'll spend about 50 to 60 cents of that dollar on payroll. And so for Orlando Health, that's generally what we spend.
Excellent. Thanks for explaining that.
You're welcome.
You guys ready for your next statement?
Yeah.
Perfect. We receive 98 cents for each dollar spent on a Medicare patient. You guys got it. That's false. We actually only receive 84 cents for each dollar spent on each Medicare patient. So Daniel, can you explain why that is?
So Medicare pays us basically per encounter, whether it's inpatient or outpatient, and there's multiple factors that affect the percent of that spend that they pay us, whether it be length of stay or the number of tests done. So actually, if we can lower those numbers, we can make that percent higher.
Thanks for clearing that up. That makes a lot more sense now. You guys ready for the final statement?
We're ready.
Okay. Orlando Health can operate for a full week or 7 days without a single dollar coming in. You got it. Once again, 3 for 3. And this is actually really impressive. Orlando Health can go 272 days without a single dollar coming in. So Kurt, can you explain a little bit of how that's even possible?
So Brittany, the term for that is called days cash on hand, and over time Orlando Health has built up enough cash in the bank to be able to pay the bills for 272 days if we didn't have any more revenue coming in the door.
That's a really good safety net that we can go 272 days without any money coming into us. That's amazing. Well, thank you for that answer, and
Sure.
Thank you all for coming in, and thank you for watching Rock Your Role. And last week, the Orlando Health Innovation Showcase was held presenting concepts from the Foundry program, which provides a process to support creative team member ideas with strong commercial potential. Orlando Health selected 4 ideas from a pool of applicants with solutions that align with our strategic imperatives and provide an important opportunity to impact how healthcare is delivered across Orlando Health.
Our innovators that have been going through the Foundry program were finally able to share the work that they've been producing as part of the Foundry. So this is the first chance for them to share all of the progress that they've made from really having an early stage idea to being ready to really move closer towards commercialization. Orlando Health is evaluating right now if we're actually going to invest in their ideas so that they can develop prototypes, they can build the software, they can continue to work on the robot, and it gives them some funds to kind of get through the next year, and we'll kind of see where they're at.
And were you able to attend last week's forums? If not, a recap is available on Swift. That's it for today's edition of the Orlando Health News Review. Thank you for making Orlando Health the best hospital possible. See you next week.